Okay, let's do a little review before we get started. An epidemic is A, the continuous but low-level presence of a disease in a community, B, an increase in the number of cases of disease in a community, C, caused only by airborne viruses, D, a disease that rapidly spreads worldwide. Go ahead and take a second, pause the video. Okay, hopefully you got this one. It would be B, an increase in the number of disease cases in a community. This one would describe an endemic disease, and the bottom one would describe a pandemic. This just is an outlier. Okay, so 2.4 is talking about what we call disease portals. Basically, the way diseases and infectious microbes can get into the body. And then, obviously, what comes with that, biosafety, right? This is really critical to medical professionals, both researchers in the lab and healthcare professionals in the clinic. And we're going to talk about the various ways that microbes can get in and out of the body, and then talk about the concepts of biosafety and biocontainment. So, how can infectious agents get in? Well, there's a couple of different ways, right? Let's think about all the places. So, this is going to be moving from one host to the next. This isn't like talking about necessarily specific ways, but a major one, right? Fecal oral, we talked about that time. The mucosa of the GI tract. So your gastrointestinal tract, your throat, your stomach, your intestines, there's a lot of surface area in there. There's a lot of places that if a microbe gets in, it can get into the rest of the body. So that's a big one. Ingesting contaminated food or water. The skin, right? We think of it as a nice protective coating, but any sort of cuts or nicks in the skin can allow pathogens to get in. Respiration, breathing. Airborne pathogens can be inhaled through the mouth or nose, and once they get into the lungs and the respiratory tract, they can start to reproduce. That's our COVID-19 disease. Through the urogenital tract, right? Through the urethra, sexual contact, genital mucosa. This is generally direct contact. This would include sexually transmitted infections. We also have this route called parenteral, which is direct injection into the bloodstream. That could be by an insect vector. The mosquito comes and it bites you and actually directly injects whatever it has, West Nile virus, let's say, into your bloodstream, or through contaminated needles. That could be intravenous drug users that are sharing needles, or it could be something like an accidental needle stick in the clinic. You use a needle on a patient and you don't discard of it properly and you accidentally stick yourself. This actually can cause disease and has and does cause disease quite frequently, unfortunately. And then finally, we have entry through the eye, the mucosa in there. Obviously, there's other ones, technically the ear and things like that. But these are the big portals of entry to the body. Now, of course, because of this, we have created biosafety precautions. We have universal precautions and then some standard precautions. The universal precaution is that all blood and bodily fluids should be treated like it's infectious, right? If you're working with someone that is bleeding or has fluids leaking, right, we need to treat that material as if it has an infectious agent in it. And we're going to take standard precautions that are designed by the CDC to protect medical personnel. First off, performing proper hand hygiene, right? Washing your hands, using hand sanitizer. Washing your hands is great because not only if you use soap, you're cleaning, but you're also washing and removing anything off of you. Using personal protective equipment, sterile gowns, masks, gloves. These are all important things. Face shields, eye protection. Maintaining respiratory and coughing hygiene. That goes with masks, covering your coughs, things like that. Like I said, safe injection practices, not necessarily recapping needles or things like that. That was a tough thing when I learned to work with mice, was difficult. you want to recap the needle, but you shouldn't. So you got to put your sharps in the sharp bin, things like that. Handling other sharps like scalpels, razor blades, things like that safely. Practicing patient isolation procedures, right? If they have a contagious disease, making sure they stay isolated, restricting access. Sterilizing instruments and devices. This is a big one. Keeping items clean. And we'll talk about different levels of clean because sterilization is different from cleaning. We'll learn about that later in the course and do some lab stuff related to that. So those are our universal and standard precautions. Now, in the lab, we classify risk in a couple of different ways based on what we're working with and what kind of containment it needs. So for us, we have what we call a biosafety level 1 lab. That's what our lab is. This means that everything that we work with in there is low risk to normally healthy individuals. Now, caveat, right? If you are immune compromised, some of the things we work with might not be super low risk. We take basic precautions. We wear gloves. We wear proper protective clothing like pants and shoes and things like this. And we disinfect our areas with alcohol, things like that. We don't eat. We have no food and drink in there. BSL-2 is where we could work with human pathogens that could cause mild disease. So in this case, we might use barrier precautions, work in a containment hood. With these organisms, though, there's generally a vaccine or some sort of treatment readily available. When I worked with the plague, we worked with a weakened strain of it. So this BSL-2 is the level that we worked with. BSL-3 is when we work with human pathogens that can cause serious injury. And there was one of these labs actually in the building I worked in at WSU. I never went in there because I had no business going in there, right? It's a separate room that's very controlled. It has what's called a biosafety cabinet that takes in air, sterilizes it before it comes out with HEPA filters. In this case, you're working with things where there might be a vaccine or therapy, but not necessarily. So you don't really want to infect yourself with these things. And then the baddest of the bad pathogens get worked in BSL-4. These are your things like highly virulent pathogens like Ebola, where exposure could be lethal. These are in separate facilities. They're like completely isolated from everything else. And researchers have to wear what's called a positive pressure suit. It's basically a spacesuit that gets air blown into it. And he's wearing earplugs in here because it's super loud because it's constantly blowing air into here. Because if you get a puncture in the suit, the air is going to be pushed out, not letting the pathogen in. Double gloves, fully taped up. This would be terrible to work in, right? It's very uncomfortable, hot, humid, loud, and you're working with something that could kill you. There are no treatments for these things. So there's only a few locations in the United States where you can do this work. Okay, so diseases can spread. All right, we've talked about that. Pathogens have to use a portal of entry into their host, and we talked about several of those. There are various levels of protection when we're handling potential infectious material, and we have 4 different biosafety levels for researchers that work with microbes.